As women age, particularly beyond 70, the body undergoes natural changes that directly affect skin health, hydration levels, and sensitivity. One of the most significant changes is the skin's reduced ability to retain moisture. This happens because oil sebum production decreases with age, and the outer skin layer becomes thinner. Frequent washingness, especially with hot water or harsh soap, can strip away what little natural oil remains, leading to dryness, itching, and sometimes even cracks or rashes. That's why dermatologists and geriatric health experts often recommend limiting full-body showers to 2 to 3 times a week for older adults. This frequency strikes a balance between maintaining good hygiene and preserving skin integrity. While it might sound less frequent than what many people are used to, the truth is, our bodies don't produce as much sweat and odor as we get older, especially if activity levels are moderate. For most seniors, sweat glands become less active, meaning odor-causing bacteria have fewer opportunities to thrive. Showering every single day can actually be counterproductive, causing irritation and potentially making the skin more susceptible to infections because of tiny abrasions or dryness. The 2 to 3 times per week routine is also supported by practical considerations. Many women over 70 face mobility challenges, balance issues, or joint pain, making daily showers more physically taxing and riskier in terms of slips and falls. Reducing frequency while maintaining a consistent schedule allows for safer, more comfortable bathing experiences. Plus, on non-shower days, a quick sponge bath or targeted wash of key areas such as the underarms, groin, feet, and face can keep the body fresh and clean without the strain of a full shower. Another reason this frequency works so well is its adaptability. During colder months, when dry indoor heating can worsen skin dehydration, sticking to 2 showers per week helps maintain moisture balance. In warmer months, or if someone engages in physical activities like gardening, exercise, or long walks, a 3rd shower can be added without harming the skin's natural barrier. For many older women, personal comfort and psychological well-being also play a role. Some may still feel the need for daily washing due to lifelong habits, but this can be adjusted gradually by replacing some showers with gentle cleansing routines. Using a mild fragrance-free cleanser and moisturizing immediately after bathing ensures that the skin remains soft, supple, and less prone to irritation. In essence, 2 to 3 showers per week is not about lowering hygiene standards, it's about optimizing them for the needs of the aging body. It acknowledges that hygiene isn't just about frequency, but about method, skin protection, and overall comfort. By following this approach, older women can maintain a healthy balance, staying fresh, clean, and confident, while preserving their skin's health and minimizing risks associated with overbathing for women over 70. A daily sponge bath is a gentle, yet effective way to maintain cleanliness and comfort without subjecting the skin to the drying effects of a full shower. While showering 2 to 3 times a week is generally recommended for optimal skin health, personal hygiene still requires daily attention, especially to areas where sweat, oils, and bacteria can accumulate. A sponge bath bridges this gap, offering a practical, skin-friendly solution that keeps you feeling fresh every day. A sponge bath, sometimes called a bed bath or partial bath, involves using a washcloth, soft sponge, or cleansing wipes with warm water and a mild, non-irritating cleanser to clean targeted areas of the body. The focus is on high-odor and moisture-prone zones, such as the underarms, groin, under the breasts, feet, and face rather than the entire body. This selective cleaning approach removes bacteria and prevents unpleasant odors while avoiding the overwashing of less problematic skin areas. The benefits extend beyond hygiene. For older women with mobility challenges, joint pain, or balance issues, sponge baths can be done while seated, reducing the risk of slips and falls associated with showers. This makes them not only a practical alternative but also a safer one. They also save time and energy, which is especially valuable for those managing fatigue or chronic conditions. Sponge baths also allow for better control over water temperature and moisture exposure. Since older skin loses hydration quickly, even brief contact with hot water can strip protective oils. A quick, targeted cleanse with lukewarm water helps avoid this, while still giving a refreshed feeling. It's also an opportunity to inspect the skin for any early signs of irritation, redness, or infection, something that might be overlooked in a hurried shower. For those concerned about maintaining a pleasant personal scent, Sponge baths are surprisingly effective. Body odor primarily develops in warm, moist areas where bacteria thrive. By washing these zones daily, you're eliminating the main source of odor. Fresh clothing, especially undergarments, further enhances the sense of cleanliness and comfort. Another advantage is that sponge baths can incorporate moisturizing into the same routine. After cleansing and patting the skin dry, applying a gentle, fragrance-free lotion or cream helps lock in moisture and protect against dryness. This is particularly important for areas like the shins, forearms, and hands, which often suffer from age-related dryness. Many women also find that incorporating a sponge bath into their morning or bedtime routine provides a psychological boost. The act of freshening up, even without a full shower, can make you feel more energized in the morning or more relaxed before sleep. It's a self-care ritual that supports both physical hygiene and emotional well-being. In short, daily sponge baths are an essential complement to less frequent full showers. They protect the skin's health, maintain personal freshness, reduce safety risks, and preserve energy, all while being quick and easy to perform. When paired with the 2 to 3 showers per week guideline, they create a balanced, sustainable hygiene routine that works perfectly for the needs of women over 70. For women over 70, maintaining skin health becomes more challenging because aging skin naturally loses its ability to retain moisture. The outer layer of the skin, known as the epidermis, becomes thinner, and the sebaceous glands produce less oil than in younger years. While cleanliness is important, showering too frequently, especially with hot water and strong soaps, remove the skin's remaining natural oils, leading to dryness, irritation, and even microcracks that can invite infections. Natural oils form a protective barrier on the skin, helping to lock in moisture and keep it supple. When these oils are stripped away by overshowering, the skin can become tight, itchy, and flaky. This is not just uncomfortable, it can also make the skin more vulnerable to environmental irritants and bacteria. In some cases, overshowering can worsen chronic skin issues such as eczema, dermatitis, or psoriasis, which already tend to flare up more easily in older adults. The problem is often compounded by the types of cleansers used. Many traditional soaps and body washes contain strong detergents, fragrances, and alcohol-based ingredients. While these might feel refreshing in the moment, they are harsh on aging skin. Combine that with frequent scrubbing or loofah use, and the damage can be even greater. Overshowering also disrupts the skin's microbiome, the beneficial bacteria that live on our skin and help maintain its health. This natural ecosystem helps protect against harmful microbes, regulate inflammation, and keep the skin balanced. Daily hot showers can wash away these beneficial bacteria, leaving the skin less able to defend itself. For seniors, whose immune systems may already be less robust, this disruption can have noticeable effects over time. Another overlooked consequence is temperature and water exposure. Prolonged contact with hot water not only removes oils but also increases transport water loss, TEWL, a process where moisture escapes through the skin barrier. For aging skin, which already struggles to retain water, this can result in chronic dryness that's hard to reverse. Beyond the physical effects, overshowering can lead to unnecessary fatigue or dizziness for older adults, especially those with balance issues, low blood pressure, or joint problems. Showers require more effort than a sponge bath, and doing them daily can become physically draining. The solution is not to avoid bathing altogether, but to find the right balance. Limiting full showers to 2 to 3 times per week while using sponge baths on other days helps maintain hygiene without stripping the skin's protective oils. When showers are taken, it's best to use lukewarm water, mild soap only where needed, such as underarms and groin, and to follow up with a moisturizer immediately afterward to replenish lost hydration. In essence, overshowering is a case where more is not necessarily better. For older women, protecting the skin's natural oils is just as important as staying clean. By being mindful of shower frequency and method, you can keep your skin healthy, comfortable, and well protected against dryness and irritation. For women over 70, the way you shower is just as important as how often you shower. 2 key factors, water temperature and duration, play a huge role in protecting aging skin. Using lukewarm water and keeping showers short helps preserve the skin's natural oils, maintain hydration, and reduce irritation, all of which are essential for skin health in later years. As we age, our skin becomes thinner and more sensitive. The sebaceous glands produce less oil, and the skin's ability to retain moisture declines. When showers are taken with hot water, the heat rapidly. For women over 70, moisturizing after bathing is not just a beauty step, it's an essential part of skin health. As we age, our skin's ability to produce natural oils diminishes, and the outer protective barrier becomes thinner and less effective at retaining water. This makes the skin more prone to dryness, flakiness, irritation, and in some cases, painful cracking. Applying moisturizer immediately after bathing is one of the most effective ways to combat these issues, helping to lock in the water the skin has just absorbed. When you shower or take a sponge bath, the skin temporarily absorbs moisture from the water. However, without a protective layer to seal it in, that moisture quickly evaporates, taking more hydration with it, a process called transepidermal water loss. This is why dermatologists recommend applying moisturizer within 3 minutes of bathing, while the skin is still slightly damp. This quick action traps the water in the skin, keeping it soft, smooth, and well-hydrated. The choice of moisturizer matters, too. For older skin, thick, fragrance-free creams or ointments are generally more effective than lotions, which tend to be lighter and less hydrating. Ingredients like glycerin, hyaluronic acid, ceramides, and shea butter are particularly beneficial, as they help replenish and strengthen the skin's barrier. Petroleum jelly-based products can be excellent for sealing in moisture, especially on very dry areas like elbows, knees, and heels. The application technique is also important. Moisturizer should be gently smoothed onto the skin rather than rubbed in vigorously. To avoid irritating delicate skin, it's best to cover the entire body, paying extra attention to areas prone to dryness such as the lower legs, forearms, hands, and feet. Hands, in particular, tend to dry out quickly due to frequent washing, so keeping a small container of hand cream nearby for reapplication throughout the day is a smart habit. For women with mobility challenges, keeping moisturizers in easy spots like the bedside table or bathroom counter can make it easier to maintain the habit. Using pump bottles or wide-mouth jars also helps reduce strain on arthritic hands. Moisturizing after bathing offers more than just physical benefits. Well-hydrated skin feels more comfortable, reducing the itchiness and irritation that often accompany dryness. This can improve sleep quality, since nighttime itching is a common issue for older adults. Smooth, healthy-looking skin can also boost self-esteem and confidence, making personal care routines feel more rewarding. Additionally, consistent moisturizing can help prevent more serious skin problems. Dry, cracked skin can become an entry point for bacteria, leading to infections such as cellulitis. By keeping the skin supple and intact, you reduce these risks significantly. In essence, moisturizing right after bathing transforms a basic hygiene step into a powerful act of skincare and protection. For women over 70, it's a small, quick habit with a big payoff, keeping the skin healthy, comfortable, and resilient against the challenges of aging. Done consistently, it can make a noticeable difference in both appearance and overall well-being. For women over 70, the standard recommendation of showering 2 to 3 times a week works well under normal circumstances. But certain situations like hot weather or increased physical activity call for more frequent cleansing. This is because higher temperatures and perspiration can quickly lead to the buildup of sweat, body oils, and bacteria on the skin, which can cause odor, irritation, and, in some cases, skin infections. Adjusting shower frequency during these times helps maintain freshness, comfort, and skin health. In hot and humid conditions, the body sweats more to regulate temperature. Even if you don't feel as sweaty as you did in your younger years, perspiration can still occur, especially in areas where skin folds trap moisture, such as under the breasts, in the groin, or around the neck. Sweat itself is mostly water, but when it sits on the skin, bacteria break it down, producing body odor. In warm, moist environments, this bacterial growth accelerates, making regular washing more important. For older women who enjoy activities like walking, gardening, light exercise classes, or even housework, physical exertion can also lead to increased perspiration and oil production. This is healthy and natural, but without proper cleansing afterward, it can leave the skin feeling sticky and uncomfortable. It can also increase the risk of skin irritation or fungal infections, especially in areas where clothing rubs against damp skin. In these cases, Adding an extra shower, at least a targeted wash, can make a big difference. If taking a full shower feels tiring or inconvenient, a partial rinse or sponge bath focusing on sweat-prone areas can still provide relief. Using a gentle pH-balanced cleanser is important to avoid overdrying the skin, even when washing more frequently. Another consideration in hot weather is sunscreen use. Many older adults wear sunscreen daily to protect against skin cancer and premature aging. While this is an excellent habit, sunscreen can mix with sweat and oils on the skin, making it heavier and sometimes irritating if left on too long. Washing it off at the end of the day, especially from the face, neck, and arms, helps keep the skin clear and comfortable. Hydration also plays a role here. After showering more often in hot weather, it's especially important to replenish the skin's moisture with a quality cream or lotion. Frequent washing can strip away natural oils faster, so a post-shower moisturizing routine becomes even more crucial. Finally, there's the comfort factor. Feeling clean and refreshed after a hot day or a good workout can lift your mood, improve sleep quality, and encourage you to stay active. It's a reminder that hygiene isn't only about physical health, it also supports emotional well-being. In short, while 2 to 3 showers a week is a great baseline, older women should feel free to increase frequency during hot weather or after physical activity. The key is to balance freshness with skin protection, using gentle cleansers, lukewarm water, and moisturizers so that extra washing enhances health rather than harming it. For women over 70, maintaining personal hygiene becomes especially important when managing health conditions such as urinary or fecal incontinence, diabetes, skin disorders, or a weakened immune system. In these situations, the standard showering frequency of 2 to 3 times a week may not be enough. Extra cleansing, sometimes multiple times a day, is often necessary to protect skin health, prevent infections, and maintain overall comfort and dignity. Incontinence, whether urinary or bowel-related, can cause prolonged moisture and bacteria to remain on the skin. This combination creates a warm, damp environment where irritation and infection thrive. The skin in these areas is often more delicate due to age-related thinning, making it even more vulnerable to breakdown. Without prompt cleaning, conditions such as incontinence-associated dermatitis, IAD, or fungal infections can develop. To prevent these issues, it's important to cleanse the affected area immediately after each incident, using gentle, pH-balanced wipes or warm water with a mild cleanser. This targeted hygiene may be needed several times a day, in addition to regular full-body showers. For women with diabetes, skincare requires extra vigilance because high blood sugar can impair healing and increase the risk of infections. Even minor skin irritations can turn into more serious problems if not addressed quickly. In these cases, showering or carefully washing after sweating, using the restroom, or being exposed to dirt and bacteria is a proactive way to protect against complications. Moisturizing afterward is equally important to avoid dryness and cracking, which can create entry points for infection. Certain skin conditions, such as eczema, psoriasis, or chronic dermatitis, can also require tailored hygiene routines. While overwashing can worsen symptoms, underwashing can allow sweat, allergens, or bacteria to irritate the skin. The balance often involves more frequent, gentle cleansing of problem areas while avoiding harsh soaps or scrubbing. In some cases, a doctor may recommend specific medicated washes or moisturizers as part of the daily routine. For women with mobility issues or chronic illnesses that make showering physically difficult, extra hygiene may mean incorporating more frequent sponge baths or using no-rinse cleansers. Caregivers can assist with these tasks while ensuring that privacy and dignity are respected. Maintaining cleanliness not only protects physical health but also boosts emotional well-being, helping the person feel comfortable, confident, and socially at ease. Another scenario where extra hygiene is beneficial is during or after medical treatments, such as chemotherapy, radiation, or surgeries. These can weaken the immune system or cause increased skin sensitivity. During such times, healthcare providers may recommend specific cleansing schedules to reduce infection risk and promote healing. The main principle in all these cases is adaptability. Hygiene routines should be flexible enough to respond to health needs as they change. While general guidelines work for most healthy seniors, individual conditions may require more frequent and targeted cleaning. By recognizing when extra hygiene is needed and taking steps to address it promptly, older women can protect their skin, prevent discomfort, and maintain a higher quality of life. For women over 70, maintaining personal hygiene is about more than just staying clean, it's also about staying safe while doing so. The bathroom, and especially the shower, is one of the most high-risk areas for falls among older adults. Wet surfaces, reduced balance, slower reflexes,